Is that clear? It's all Yang Ming, Yang Ming, Yang Ming, in the presence of stomach and spleen. Beautifully easy. You can add points. You start with local pain first and then you add the pattern. If, for example, someone came with a pain on the left little finger here, this is a pain. So now my drawing is not very good. Like this. This is a pain, and the pain is here. And also he is having cold. How you will treat this? You may think, oh, okay, let's do mapping. How we do mapping? This is his leg. This is his leg, and we will put the needles into the little finger on the outer side. Few needles, Ashi points. Nice. Treat it. And then we apply the pattern for general pattern of respiratory disorder. For example, Tai Yin Yang Ming. If this patient is nervous, we can apply Ju Yin Yang Ming. The only thing that we have to care about is that yang needles must be in, yang channels must be in the yang corner. This is yang because we needle the outer side of the middle finger, and this is bladder. So we apply the pattern in a way that yang meridians will be in the yang corner. So stomach will be here, spleen will be here, large intestine here, and lung here. Is that clear? Yang channels will go with yang meridians, and then you adjust the rest.
And the pain is on the yang?
The pain was in here, on the small intestine. Doesn't matter where the pain is. The matter where we put the needles. The pain can be anywhere. We put needles into the yang meridians, so it must be only yang. We can't mix up yin and yang in the same corner. This is a very important concept. Let's do some revision now. For Yang Ming patterns, what did we learn so far? All of them are Yang Ming. Large intestine, stomach, large intestine, stomach, large intestine, stomach. And here we had stomach and only stomach. And here will be spleen. All of them are Yang Ming. So when the patient comes with digestive issues, so for digestive issues, if you remember, we'll refer to Jimmy Chung pulse diagnosis. If you take the right Sun, Sun, Guan, and Che. So the pulse on Sun or Guan will be either weak, weakness we put like the arrow down so it doesn't rebound, or it can be stagnant, I put like this. Stagnant pulses, they are like mashed potatoes, so you don't feel the borders of the artery so well. Or any of them is out of balance, we think straight away about Yang Ming. Why? Because right soon is lung, large intestine, and right Guan is stomach and spleen. So if these two pulses are out of balance, we think about these 4 patterns. If you see these pulses like this is Yang Ming business. And it can be either Tai Yin Yang Ming. What is Tai Yin? It's lung and spleen. Or it's Jur Yin Yang Ming. What is Jur Yin? Pericardium and liver. Or it can be pericardium, kidney, Yang Ming, which is here. We also call it 4 magic meridians of Dr. Tan. Or it can be pericardium Sinjiao, when we use the Tai Yin Yang Ming pattern for general cold, for sinuses blocked, for any issues between 2 branches of spleen meridian, and we call it the primary pattern of Yang Ming. Actually, it's so good for children. For children, we start only with this pattern if any digestive or issues or any cold. If someone came with the wiry pulse on liver meridian, for example, very wiry, don't forget that normally liver pulse should be wiry, a bit wiry. If it's not wiry, there is something wrong with the liver. If the liver pulse is like this, and it's strong, this will be Shaoyang pulse. We call it Shaoyang. If the liver pulse is wiry, it's okay. But sometimes it's too wiry and strong. And also, we find this pulse is wiry. For example, if these 2 pulses are wiry, left both guans, we usually say that liver invades spleen. But if the lung pulse is wiry, if the right Sun is wiry, we usually say that liver invades lung. This is the skin condition pulse. So, if we see that there is a liver problem, but there is not such a Shaoyang pulse, we refer to Ju Yin Yang Ming. Who are these people? They are jittery, they worry too much. Their sleep pattern is wake up, go to sleep, wake up, go to sleep. So they can wake up a few times during the night. They are uncertain, and they worry too much in general. The third pattern, pericardium, kidney, Yang Ming, or 4 magic meridians, who are they? They are tired with digestive issues. Also, last time we went through the heart treatment, gynecological treatment. Why? Because these treatments were designed because they are between 2 branches of kidneys. The problem resides between 2 branches of kidneys and 2 branches of stomach. So everything in here belongs to this pattern. And the last pattern, which goes under digestive branch, we call Sinjiao pericardium, stomach, spleen. It's also for digestive system, but with a bit of edema, water retention. Yes, Sinjiao and spleen are two meridians that work with water retention. Sinjiao moves what? Water. Yes, it's responsible for water metabolism as well as the spleen.